So what we'll be talking about today is how to know if your back pain could be something more serious. Majority of back pain is usually due to our own making, such as poor posture, lifting incorrectly, having weak muscles of the back, or back problems such as scoliosis, which is abnormal curvature of the spine, or osteoarthritis, which is wear and tear of the spine. Check out my video link on the description page below, also on what causes back pain and how to manage it. So you want to know, when is your back pain serious? i.e., could it be an infection? Could it be a fracture of the spine? Could it be damage to my nerves that makes me lose sensation or paralyzed? Or could it be cancer? Especially if you know someone that had back pain and thought, oh, don't worry about it, it's just my back playing up, and then later down the line they were told it's cancer. There are signs and symptoms, what we call red flags, that will tell you if there's something going on, and spotting these signs early leads to better outcomes of treatment. So let's look at what symptoms of back pain would make you suspect cancer. Gradual onset back pain. So back pain that starts gradually and then gets worse. So think of niggling back pain that then becomes more severe. Usually with typical back pain, it improves over time with treatment. Severe constant back pain and pain at night. So you might have severe back pain that's constant despite any position such as lying, sitting or standing, and the back pain wakes you up at night or prevents you from sleeping. Thoracic back pain. Your thoracic spine is located at the back of your chest and goes down to the level of your belly button. In your spine you've got the cervical, thoracic, lumbar and sacral spine. It is unusual to have thoracic pain without an obvious cause such as wearing backpacks or poor posture, so pain in this region should be investigated. Localized tenderness. Pain in the spine that is localized, so you might be able to pinpoint the exact spot where the pain is, as in most cases of back pain, it tends to be more diffuse. Worsening back pain. Ongoing back pain despite painkillers, exercise, physio, heat, that has been ongoing for over 6 weeks and is getting worse. Weight loss. You might present with other symptoms such as unexplained weight loss that can be a sign of cancer. Previous history of cancer. If you have a previous history of cancer, such as breast, bowel, lung or prostate cancer, any of these cancers can spread to the spine and cause back pain. Now let's look at the symptoms to make you suspect nerve damage. One of the conditions to look out for is called cordia equina syndrome, which is compression of the nerves at the end of the spinal cord, and is a medical emergency as delayed treatment leads to permanent nerve damage. Weakness in both legs. So you have weakness in both legs that's getting progressively worse and you are unable to do movements such as straightening the knee or bending the foot. Bladder weakness. You might not be able to pass urine as the message is not reaching the brain that the bladder is full due to nerve damage, or you might not be able to hold your urine and you leak before you reach the toilet. Bowel weakness. So look out for loss of sensation of your back passage, such as when you're passing stools or when you're wiping your bottom with tissue, or you might not be able to feel around your inner thighs. Also look out for not being able to control bowel movements, which leads to stool leakage or being constipated. Erectile problems. As a man, you might not be able to achieve erection or ejaculate, or you might experience loss of sensation during intercourse. So now let's look at the symptoms to make you suspect infection. You can have infection of the discs such as discitis, or infection of the bones known as osteomyelitis. So if you present with back pain as well as symptoms of fever or a condition that makes you immunocompromised such as tuberculosis, diabetes, a recent urine infection, HIV, taking drugs to suppress your immune system known as immunosuppressants such as steroids, or if you've had a back procedure such as lumbar puncture or epidural injection for back pain. Now let's look at the symptoms to make you suspect fracture. So if you've had a major trauma, such as a road traffic accident or you've fallen from a height, or it might be minor trauma such as twisting movement of the back. If you have underlying back problems such as osteoporosis, any mild impact can cause fracture of the vertebra. So for example, you might experience central localized back pain that feels better when lying down, or there might be some tenderness in a specific point of your vertebra, and you might see a deformity of the spine, where basically if you feel along the vertebra with your finger, you might feel that there is a step from one vertebra to the other. So if you have any one or more of these symptoms, then you should seek urgent help immediately. as you need urgent tests such as blood tests, x-rays, CT scan or MRI scan, and treatments depending on the cause. So these are all what we call red flags for back pain. So these are the signs and symptoms that will tell you that there is something more serious going on. If you like this video, please feel free to share and subscribe to my channel.